Hi there, I'm Dr. Jill Wener. I practiced hospital-based internal medicine for 10 years, and I am also a certified conscious health meditation instructor. Welcome to Meditation for Physicians, a guide to the rest technique, and also welcome to Module 1, Getting Started. In this module, there are 3 videos. In the first video, we'll discuss my story with meditation and how this practice found the least likely meditator ever, me. In the second video, we'll discuss how to know if the rest technique is or is not right for you. And we'll go through the course flow, the format and the topics, and how to approach each module so that you get the most out of the course. And I'll also share some rest technique success stories with you. And in the third video, I'll discuss and dispel some common meditation myths and doubts. And we'll also discuss some major ways that the rest technique is different from other types of meditation, and we'll also discuss some of its benefits. So my story was pretty traditional for a long time. I went to Emory Medical School and did my residency in internal medicine at University of Washington and got a job in academic hospital medicine straight out of residency starting in 2006 at a busy academic medical center in Chicago. And everything was going along great until 2011 when I got extremely burnout and was crying every day. One little thing would set me off and I would just either start crying or get up and leave my office and finish doing my charting from home. I was so unhappy and I had no reserves at all for anything to go against my expectations. Around that time, I met somebody who told me they meditated. And if you had asked anyone at the time who was the least likely person that you know to begin a meditation practice, they would probably say Jill. I was pretty intense. I loved my job and I was really passionate about it, but I was pretty intense. And I think a lot of my residents and students, while they enjoyed working with me and learned a lot from me, they found me I had a lot of high expectations. And I think they were maybe a little bit scared of me actually. So I met this person who told me they meditated, and I went to go hear their teacher speak and brought in my most skeptical attitude and was ready to be super fancy doctor pants and to leave there and to not sign up for the course. But what ended up happening is that this teacher, who is a yoga teacher and then became a meditation teacher in this tradition, he blew my mind. I felt like for the first time someone was able to help me understand what was happening inside my body with all the stress I was experiencing in a way that I didn't even understand it myself with all of my medical knowledge. And what I noticed is first off, I decided to sign up for the course. It was a lot of money and it was a big commitment, and I was very nervous about it because I didn't know anyone who meditated at the time, but I also knew this is something that I have to do. And so what I noticed, the first thing is that I was able to fit the meditations into my daily life. We carried pagers back then. I know a lot of docs don't anymore, but I was able to fit the meditation into my life despite having my pager on me 24/7. The second thing I noticed were that the meditations were easy and they felt really good to do. And so there wasn't any of that like beating my head against the wall trying to clear my mind of thoughts that I used to get if I ever tried meditation, like in a yoga class or something like that. The third thing that happened is that I actually was having meditation experiences during the course. It was a 4-part course. It was about an hour and a half each day, 4 days in a row. And during the course, I was having actual meditation experiences, which for me, in my skeptic state of mind, really helped me realize that what I was doing was something real. And then the fourth thing that happened is I started getting benefits really quickly. I lost my road rage in about 3 weeks. I stopped crying every day. I wasn't burnt out anymore. I had so much more reserve and something called adaptation energy, which we'll talk about later in the course. And I just felt so much better. And I was extremely productive in my academic career. I got a promotion to being the director of education in the Division of Hospital Medicine. I was mentoring faculty. I was doing presentations and workshops on the national and regional level. And things were going much better. A couple years into my meditation practice, I went on a retreat to India with my teacher, and we did some pretty intensive meditation on that retreat, which was different than I had been doing just at home on my own. And on that retreat, I was just having these even more incredible experiences that I had when I was doing my regular meditation practice. And my teacher said to me, "Have you ever thought about becoming a teacher?" And the answer was absolutely not. I'm a doctor. That's what I do. And eventually I thought about it a little bit more, and I thought, you know what, I'll become a teacher It's a 3-month teacher training in India. I'll do that and I'll still practice hospital medicine. Maybe I'll do, 30 or 40% of full time and then I'll teach meditation the rest of the time. And that's what I had planned to do until I had the opportunity to move overseas to China for before my meditation teacher training. So I knew I would be gone for those 3 months, but then I had this incredible opportunity to move to China. And I thought, you know what, life is too short. I'm going on my teacher training anyway. And so I decided to take this opportunity and move to China. And that is why I left my job. I never actually intended to leave medicine. It just kind of happened that way. And so I moved to China, then I did my teacher training. And after being out for about 6 or 7 months and getting this training, which I know, as you'll see, isn't just relaxing. It's not just a Band-Aid, but it actually reverses the damage done from stress in our body. I realized, you know what? I want to teach this full time. I want to teach this to healthcare professionals. I want to teach this to patients. I want to teach this to particularly to doctors so that they don't have to get to the point where I got with burnout. They can prevent the burnout or treat the burnout before they get to the point that rock bottom where I was at in 2011. So the rest technique is a culmination of my 8+ years of meditation experience and 3+ years of teaching conscious health meditation. And what it is really it's the fundamentals of conscious health meditation, the basics of the technique, of how to fit it into your day, all the same benefits, but without having to be taught in person 4 days in a row and in a way that's adaptable to your busy lifestyle so that you can take the course at a time that's right for you, and it doesn't have to be only in Atlanta or only where I am located. I am so excited to share this technique with you, and let's get ready for the second video. I'll see you there.